All right, we are going to talk about some of the basics of giving yourself an injection, whether it's a peptide or NAD or glutathione. These are some of the foundational basics that you need to know. So to begin with, you're going to have a vial and it's probably going to have a cap on it. And that cap could either be like this, and that you would flick off in order to expose the rubber hub and draw it up. Or other vials like NAD will have a metal cap. So this guy's a little bit harder to get off. You could use your nail and flick it up. The other option is to use a butter knife or a pair of scissors, but you can see now I've got that up, and that's going to expose the rubber hub. In order to draw up the medications, you want to always sterilize the rubber hub with an alcohol wipe before you put the needle into it. And so when they've been in your refrigerator, before you get started to drop the medication, always just really clean these thoroughly in order to remove any bacteria. And those are ready to go. The other important point about drawing up medications is that you want to be very careful about not making the needle get dull. So when you draw it up, first of all, let me walk you through this little syringe. There's a cap on it, and then there's a second cap where you have the actual plunger. But back to drawing it up, I like to recommend that you have it on a flat surface and you go straight in. This allows you to do it in one puncture. Next, you invert to draw up the medication and then take the syringe out. So again, you want to make sure you have it on a flat surface. You're going in perfectly straight, one puncture, and then invert. And as you can see, as a solution is coming up in this small syringe, it should be filling the barrel. So you always want to check to make sure that it's filling the barrel. All right, so that's the basics. Now we're going to get into actually using your medication. All right, now that we're ready to inject your glutathione, we'll walk you through what that looks like. Usually it comes in a vial like this that has the metal cap, so you've already removed that and you've exposed the rubber hub. I'm going to take alcohol wipe and I'm going to clean the surface so that it's sterile. And then I'm going to draw up the medication. So I've removed the cap on the plunger, also the cap that's on the needle, and I'm going to go straight in on the surface of a table so that way you only make one puncture, and then I invert it. So let's say you're doing a protocol of 30 units of glutathione. This is a 50 unit syringe. I'm going to go to the 30. Sometimes your protocol may be 50. It might be 20. So always look at your instructions. You're going to draw that up, remove the needle. This is ready to be injected. Now that I have the glutathione drawn up, I'm going to give it in a subcutaneous injection, which means under the skin. This could be done generally around your stomach area where we have a little bit of extra loose skin. It can be done in the back of the arms. It could also be done on your inner thigh. So I'm going to take the alcohol wipe. I'm going to clean the skin. I'm going to then pinch the skin. I'm going to inject at about 45 degrees. And then I'm going to just press the plunger so the medication goes in. After I'm done, I like to take the alcohol, massage it in, and that's it.